you guys for hanging around. I guess Jessica's approved the agenda. Do we do that? Anything to add to the agenda? Anything else to add? That's right.
Y'all never said it's got an agenda besides you, so we don't know what's wrong with it.
You were sent a copy of it.
Oh, you were?
Yes, you were.
It's on the county website, so I know.
No, did you not email us the agenda? Go check email. All right.
Did have it wrong.
All right. Moving on, consideration approval of school board sponsors for Park and Residence Recreation Complex. Jack, you got that?
Not really, but we have an app.
We got it.
I don't think the G-Man dad could decide that.
We're coming out. I do think, I'm sorry to interrupt, Jack. Chuck Sutton is here. We had that discussion today. He has part of that. We told him maybe Chuck needs to be here.
Okay.
Chuck is here. I don't know on the agenda somewhere.
I don't think we need to add it. MPP?
The MPP, yeah.
We'll add that right after the park events. Sorry, I forgot that. And Derek didn't tell me about that, and I forgot it. Sorry about that, Chef. We go way back. All right, Jack, anything to add on the park events thing?
Not on the sign. I think it's pretty self-explanatory.
And I guess we have to vote to approve that. Is that correct? Gentlemen, I'm going to remove myself from the discussion and from the vote. As you'll see, number 7 field is Corbin Insurance Agency. I talked with our attorney about this. I want to make sure that my being a sponsor out there was not a conflict of interest. And full disclosure, they advertise these fields to 400 and some Chamber of Commerce members. I think Jack, it was in the paper, so it was put out there. They still had one vacancy, and actually the company that did this came to my office, Mike, and talked to my wife about it, and so she asked me about it, and so I called Chester.
That's because she's usually at the office, and you're not.
So I wanted to make sure that with any kind of conflict of interest, we'll make everything up front. Chester, I don't know if you want to address that.
I did not find a conflict.
And what that is it's not we have to pay to be sponsors. So it's a $5,000 fee, and just for the record, there's still one field available.
And it's not a contract.
Not correct.
But it's for how long?
But nevertheless, I will excuse myself from the discussion about it.
How long is the contract for?
A year.
1 year. No, I think those the naming rights are
10 years. It is for 10 years.
Did that not change? It's still 10 years.
It's what was on this one. She presented us last year.
You was 15 years.
I'll make a motion to approve as presented with stipulation of field 7 and stuff.
I second that.
All right. Motion and second. Any discussion? All in favor say aye.
Aye.
Opposed? Motion passes 4-0 with 1 abstention.
What were you voting on?
On the
Approving of the name.
approving of the names on the park and revenue.
Okay.
And media, if you would note that there is still one field available.
We
Yeah.
never got the notice on it.
We have more than,
Yeah.
I need to work on getting that stuff.
we need
The soccer field still does not have a sponsor.
3,
Chuck,
4.
Chuck?
Mr. Chairman, Chuck's Cullen is liaison to make progress. For the last several years, never since the sequester of the federal government, we've had to supplement the management of HUD. These people who supervise the program for HUD. And this board has always been good enough because HUD services a lot of Macon County residents. And Chuck is here tonight to answer any questions. As you know, there'll be in our budget discussion, we'll talk about it more. And the 30% reduction is, he has two folks. Believe me, they'll make a whole lot of money because their job is very important to a lot of folks in Macon County. Chuck is before us tonight asking that if this board could help with $5,000 to see that he could sustain the managers of this program through June, through the end of June, until we have our budget negotiations and that's our new budget. So Chuck, if you'll come forward and any questions they got. I am the lead on the MTP, and we excuse to the board on behalf of myself of not bringing this forward sooner. But with Chuck's budget and the way it works out, sometimes it's hard to get it down to the penny and know exactly where we're at. But Chuck's money does expire probably today. So it's imperative that we try to help with this. Any questions you got for Chuck? Chuck, anything you want to add to that?
No, I appreciate you bringing it forth, Ronnie. We are trying to sustain this program. It's been with us for a number of years. It does provide housing subsidy for many of the most needy citizens of Macon County. And like Ronnie said, we have 2 employees. It's basically their salaries and office and office supplies and those type of things, the administrative expenses, and we just don't get enough through the HUD funding to sustain that for a full year. So we're here asking tonight. Believe me, I would not be here unless I felt it is extremely important and important to this county to continue to provide these services.
Here's the real kicker, is that if we don't have supervision over the program will suffer, we're going to get less money from the program, less folks in Macon County is going to have low-cost housing. So, you know, I don't understand that part of the government thinking, but we've got to have the supervision, and certainly, so.
Commissioner Bill, where do you suggest we get that money?
I'd like to make a motion if we take $5,000 from contingency, and let's supplement the HUD rental assistance program until the end of June. That's a motion.
Okay, a motion and a second. For the record, you say contingency, so that's our budgeted contingency amount, not undesignated.
That's right. That's not from the fund balance, from undesignated contingency. That's and Lord can give you that thing.
Lord, we still have money in that line. And that's through June 30th. Motion second, discussion.
You see the turnaround in this check, it's been 2 years or a year or
December 2012, I do not see a turnaround. We're struggling, and the funding has not come back after that semester. Stayed consistent, just a lot lower than we had experienced in the past.
so you're looking at what was the last 2? We've done this twice before.
Yes, sir.
In a 6-month period, I think, and that was about 15,
12 and 13.
13. So you're looking at 30,000 a year.
25 to 30, yes, sir.
So that's going to be a continuing part of ours.
Yes, sir.
Because initially you were hopeful that
It's going to be a continuing need unless something major changes, and it has in the last 2 years, and I don't see it changing.
Will this be a part of your budget plan for the long term for this?
We would hope so.
For a while, they was real hope that during the sequester, the part of it, especially low-income housing, that they would recognize that, that supervision, you don't get the funds lower. So but that didn't happen either. So as the sequester continues, it's, but I determined how many families down there, 400 and something.
400 people, 157 families.
through this one specific property.
Yes. Yes, sir.
Other discussion? Hearing none, all in favor of the motion, say aye.
Aye.
Opposed? Motion passes unanimously. Thank you, Chuck.
Thank you, sir.
We have as you know, we've had a lot of discussions about our health insurance, and as I can attest to you, and changes in the past 4 to 5 years. Not only the Affordable Care Act, but the increasing cost of medical care. And so through several discussions between Derek and myself and others, we discussed it some on this board, that we needed to make sure we were headed in the right direction. We needed to get a handle on this, on the costs, make sure that we were certainly in compliance with the ACA. You know what that means, Mike? That's the Affordable Care Act.
I do indeed.
So with all that said, under our direction, the county manager has been seeking options and discussions with folks about this. So, Mr. Manager, we'll turn it over to you and let you give us a presentation on your findings. Could you say Bill Jackson County? Did I say that?
Bill,
It'll be on the Facebook.
Yeah, we know that. Sorry, Derek. We carry on.
Thank you, Mr. Chairman, members of the board. First, I'd like to say that this has,
Thank you.
as highlighted in my budget message for this fiscal year, we did experience, or we knew we would be experiencing in fiscal year 15-16 an urgent need for changes in the health insurance fund. And this has been the number one issue, I would say, since I started as county manager, that I've dedicated and devoted a lot of my time to, and that's because that this affects so many employees, 408 employees, their families, their children. Many employees rely on this fund heavily. It's their health insurance. And as the old saying goes, if you haven't got your health, you haven't got anything. So in doing that, I have called upon a group of county employees that have assisted me in this process, along with Mr. Mike Norris that's here tonight with Hawaii Insurance, the county's insurance broker. We have Ms. Pam Perry, Ms. Lynn Wright, Mr. Warren Cade, Mr. Chris Stahl, Mr. Mike Decker, and Ms. Lori Hall. All of these are members of the committee that was established to look at this need for change and what we were going to do in light of it. I'm going to give you a brief presentation that will highlight the main areas in the report that I provided to you. What we'll do first is talk a little bit about the health insurance fund, the expenditures, the revenues, kind of how that fund works, and how that these expenditures and revenue have created this need for change. To meet this need for change, as I said, I called on the most valuable resource that the county has, and that's its employees. And they have worked diligently through this process, as you will see in this presentation. And I'm just a mouthpiece for a group that has done a great deal of work, and it's their thought and their recommendations that are here today. These recommendations include reducing expenditures. There's some recommendations for increasing revenues. And when we look at that, we'll look at the effect that this will have on the insurance plan. And moving forward, what our new plan, if implemented, will look like. To talk about the expenditures, when you talk about expenditures in the health insurance fund, or let's back up. Let's talk about the health insurance fund as a whole to begin with. The health insurance fund is defined by our CAFR, our Certified Annual Financial Report, is intended to function like an account in the private sector. And each of you gentlemen are in the private sector, and you know and are well aware that a fund in the private sector focuses on the bottom line. Revenues have got to exceed expenditures to keep you afloat. The health insurance fund is no different, and it's intended to function like that. When we look at expenditures in this fund, over the past 3 years, 2012, 2013, 2014, on average, we saw expenditures total about $4.2 million. And expenditures are medical claims, dental claims, reinsurance premiums, admin fees. All those contribute to that $4.2 million in expenditures. When we look at projected expenditures for 15-16 under our current plan, and assuming that we did not meet the need for change, and we just continue as we're going right now with the current plan, the current funding rates, the expenditures that were given to us from our current, based on rates provided to us by our current third-party administrator, were $4.5 million for fiscal year 15-16. And a lot of that increase is directly attributable to the Affordable Care Act and the costs that come associated with that. Revenues in the fund, currently, there are two primary sources of revenue in the health insurance fund, one being county contribution and one being employee contribution. And currently, this fund, at our contribution levels right now, generates about $3.2 million in annual revenue. You can see here the county contribution is at 2010, that'll be the column on the far right, is at $500 for an employee only, $870 for employee spouse, $677 for employee child, $870 for employee children, and $901 for a family. Now, that just contributes to the total cost to insure that person in each of those categories. The employee, of course, would pay zero. The person with employee spouse coverage would pay, the person with employee spouse coverage would pay $200 a month to go with that $870. The person with employee child coverage would pay $86 a month to go with that $677. The person with their employee children coverage would pay $200 to go with that $870 county contribution per month. And the person with family coverage would add an additional $344 a month to that $901 in county contribution. And again, at our current levels, we generate approximately $3.2 million in annual revenue. If you'll recall the expenditure slide, our plan was expected to yield about $4.5 million in expenditures in the coming fiscal year. And when we take, assuming again that we continue on the current course and make no changes, we're generating $3.2 million in revenue annually. So that creates a problem, that creates an obvious deficit of $1.32 million that we're going to have to make up. And as you can see, the position is expected to finish up at around $520,000. And to go back to the health insurance fund, your net position acts like a safety net or a reserve fund in your health insurance account. In years when your expenditures exceed your revenues, money is taken from this fund to cover that deficit. Conversely, in years when your revenues exceed your expenditures, you put money back into this fund, and when you fall upon hard times, you can rely on this fund to cover that deficit. And as you can see here, net position reached an all-time high in 2009 of $5.9 million, close to $6 million in 2009. And if I can go back a slide to the county contribution levels, if you will look at what happened in the years following this 2008, 2009, you can see the county contribution levels were fairly substantially above what they are today. In 2008, the county was contributing $350 more in each coverage category than they are today. This contribution decreased again in 2009 to $650, so it fell $200 in each category between 2008 and 2009, and another $150 across each category in 2010. And as this chart shows, that has had a substantial impact on the net position of the health insurance fund, or again, that safety net. And you can see by the green line here that represents revenues, and you can clearly see when the county contribution levels decreased, the revenues started falling. And with healthcare, expenditures continued rising, and each year from 2009 to 2015, we have seen a deficit in this fund. Annually, the deficit is about $700,000. And over the course of this time period from 2009 to 2014, the insurance reserve fund has declined by 72%. So going back to where we are today, knowing that our plan is going to as we continue on it currently, will be around $4.5 million in estimated expenditures. Knowing that we have revenues that we can project coming in at $3.2 million, and knowing we have $520,000 left in our net position or reserve fund, what would happen if we continued on this course at the end of next fiscal year, the end of fiscal year 15-16, we would deplete in its entirety the health insurance reserve fund and still have an $800,000 deficit remaining in the health insurance fund that would be unmet. So what that would force us to do is it would force me to have to come before the board and ask to appropriate that $800,000 from fund balance in the general fund just to keep the health insurance fund rolling, because we would be out of money in our reserves and nowhere else to turn.
And then you got the next year.
Right. And then, oh my gosh. So in seeing that, we had to ask ourselves, just like you said, Mr. Chairman, is this sustainable? And looking into fiscal year 16-17, after that $520,000 in net position is depleted, if we continue on our current course, that means in 16-17, I would be coming before the board asking for $1.32 million from fund balance to cover the deficit. And that's assuming that the insurance costs don't increase between fiscal year 15-16 and 16-17. So by this and looking at this information, it became clear that there was an urgent need for change in the health insurance fund. And in thinking about it, I knew that it was going to be a huge and it was going to be a complicated task to get into this fund and really look at it, look at what made it work, look at potential changes that we could perform in the fund to make it again sustainable. So I had to ask myself, where are you going to turn to? And I turned to those people that I mentioned earlier, those Macon County employees that they have families on the fund. The fund takes care of them, takes care of their children, takes care of their spouses, and it is so crucial to the employees. I knew that they would become engaged, and they did. They become so engaged in this, and much hard work has went in to the recommendations that this health committee will show you tonight. We started meeting in August, and to start out with, on the 1st of August, on August 2nd, we had 3 employee meetings at the community building where we brought every county employee in throughout the day, 3 separate meetings. We showed them the problems that were occurring in our health insurance fund and made them aware up front that we were going to have to change this plan to make it sustainable to the county. At this time, the Health Insurance Committee was introduced, and beginning later that month, through this month, over the course of that 7-month period, this committee has met 10 times. During our meetings, we analyzed and compared our plan to health insurance plans from across the state, health insurance plans from across our region, in both the public and private sector. We have had representatives from surrounding counties come in and give us presentations as a committee on changes they've made to their health insurance plans and the effects these changes have had once they made it. We feel like by getting this knowledge and an understanding of our plan, where it stacks up to other plans in the region. That gave every employee that was serving on this committee a good foundation as we move forward to discuss ways to make this fund sustainable. And it jumped out clear as day, the things we were going to have to do. Number one, we were going to have to reduce expenditures. Number two, we were going to have to increase revenue. Number three, we were going to have to retain a high quality and affordable health benefit for our employees. One last thing I'll say about this Health Insurance Committee before we go through these recommendations. You'll notice these recommendations are a representative of sacrifice. They'll be representative of sacrifice at a county level and sacrifice at the employee level. And going through this process, what stood out to me more than anything and really spoke to the heart of a public servant is those employees that are willing to have the discussion about making sacrifices. Sacrifices that will directly impact the quality of benefit that they receive. But they did it in the name of public service. They did it in the name of keeping the cost to the county at the lowest level that we possibly could. That speaks volumes for the kind of employees that we have in Macon County. The first recommendation for reducing expenditures is to reduce the coverage levels. Right now, Macon County, under the Affordable Care Act, we have a platinum plan. And when you look at information on the Affordable Care Act, there are 4 tiers of plans. There's a platinum, a gold, a silver, and a bronze. And then there's a catastrophic tier, but that's been left out of this explanation. These different tier levels take into consideration monthly premiums, deductibles, co-payments, co-insurance, and out-of-pocket maximums. So they put all that into a package, and whenever an average person experiences cost and they go to pay in their insurance, 90% of it is paid by the health plan. That's a platinum plan. And that, again, that's taking into consideration the monthly premiums, the deductibles, the co-payments, the co-insurance, and the out-of-pocket maximums. So when they're getting those costs paid at 90%, that's a platinum plan. When they're getting those paid at 80% by the plan, the employee having to come up with 20%, that's a gold plan under the Affordable Care Act. And it goes right down the line. The silver plan, you have a little bit more responsibility passed to the employee at 30%, with the plan picking up 70%. And the bronze plan, at the lowest tier, you've got 60% of the cost of this health care getting paid for by the plan, and the remaining 40% being passed to the employee. What the committee is currently recommending would be reducing this coverage level from the platinum plan, where it currently is, to a dual option plan, a gold and a silver plan. And we'll talk a little bit more about this dual option plan in a second, but we have found, and I'll hit on it later on in this presentation, that this is in line with the industry standard of what we're seeing across the peer groups that we've compared to, and what we're seeing in the nation as a whole. And I'll show you that a little bit later. So you have a dual option plan. We're offering employees a gold plan, and we're offering them a silver plan. The silver plan is the basic level plan that the committee is recommending. In other words, all employees will be offered coverage at the basic silver level. To receive coverage at the gold level, or the enhanced level, employees getting coverage under that level will choose to participate in health risk assessments and tobacco screenings, and that will qualify them for coverage under this gold plan. To talk a little bit about the health risk assessment, and that is recommendation number 2. To talk a little bit about the health risk assessment, the health risk assessment is a very similar experience to what employees have now with the healthy heart screening at the health department, where blood work is taken to test for your cholesterol, test your blood sugar, you get your blood pressure taken, and so on and so forth. The health risk assessment will only require additional tests to be ran on the blood work to test for major conditions such as heart disease and diabetes. If the results of the health risk assessment identify risk factors for these major conditions, the employee will need to enroll in and participate in the disease management programs. And what this does is they will be conducted, and we're working out the details. We're meeting with a rep later this month. It will be, disease management will be offered by Blue Cross Blue Shield and can be coordinated with our health department if we choose to do so. But participation in these programs by employees, it will better educate them on that chronic condition and better educate them on proper ways for managing it. As part of this health risk assessment, employees will undergo screening for tobacco use. Those that test positive for tobacco use will need to enroll and participate in the tobacco cessation program in order to remain on the enhanced gold plan. This cessation program, like the disease management program, has some fine details that will be worked out with the county and the health department. And one thing that jumped out at me is, as we looked at many plans, again from the public and private sectors, is this is nothing new to the industry. We're seeing employers, public and private, such as Jackson County, Lowe's, the state of North Carolina health plan. All these plans are offering this dual option, similar to what Macon County is proposing. The health risk assessment, disease management programs, as well as tobacco screenings and cessation programs have become integral parts of the health insurance plan. Tobacco usage, as well as unidentified and untreated diseases, have been proven to negatively impact the health of employees. This, in turn, impacts your claims level as an employer. So what this is doing is these reinsurance companies that give you quotes on what it's going to cost to insure your census of your plan, they look favorable on this, and you get better rates when you have mechanisms like this in place that encourage the employees to assist their employer in controlling and maintaining health care costs. And they do this by encouraging them through things like this to become more involved and aware of their health care on a personal level. The third recommendation for reducing expenditures is an employee health clinic. And the committee discussed this at length with the health director who was on the committee, Mr. Jim Bruckner. And we're very fortunate. Mr. Bruckner informed us that he actually has money his department gets from the federal government that would allow him to begin implementation of this health care clinic with minimal to no cost to the county whatsoever. The infrastructure is in place. He will be hiring a nurse practitioner who will operate under the medical director, who will operate under the medical director that will be at that clinic, and this will give employees a quick and affordable access to health care. Utilizing this clinic, employees would be given 1 hour of work time that would not be counted toward their sick leave. They would pay only a $5 copayment for the visit and a $1 fee for over-the-counter medication and a $2 fee for a lab service. And when you look at this compared to the copay of a doctor's visit at $50, it is gives our employees, again, a very quick and affordable option to get help for health care. The examples of illnesses that can be treated at the health clinic include fever, chills, sweats, common cold, sore throat, tonsillitis, stomach ache, nausea, headaches, bladder infection, bronchitis, and those are just a few. At this health clinic, these illnesses can be diagnosed and treated. Not only will this create a healthier workforce, reduce the time out of work for employees, it will contribute in the long range to reduce plan costs. And that was something that, in speaking with everyone that has implemented, like Jackson County, this employee health clinic, they have all had favorable experiences with these clinics and reducing their overall claims experience. The fourth recommendation for reducing expenditures is to begin the county contributing a flat 55% for dependent coverage. Right now, when you look at the dependent coverage levels that the county offers and the portions of county contributions, they're scattered, and there's no methodology for these contribution rates. The 55% contribution rate would not only bring consistency to the county's contribution for dependent categories, and currently they range from 54% on family coverage to the county contributes 67% on family coverage. So not only will this shore this up and create consistency, it will create equity as well. We had a lot of employees from the work group and a long discussion on, employees that had talked with their coworkers and with their peers for some time now, and they asked, well, if I have family coverage, then the county's contributing $901 for me. But if I have individual coverage, the county is contributing $500 a month for me. So really, you're making $400 more a month than I am by having family coverage. And so we're seeing in counties like Jackson County, Talbot County. Yes, sir.
I was wondering, did the committee talk about under the employee health clinic the liability issue?
We did discuss the liability issues, and to my knowledge, all that is within would be covered under the health department.
So if you go there and you say you got a cold and actually they had something very serious for coverage, right?
Anything serious would be referred to your physician or referred on to
What
the
are they making
hospital.
this diagnosis for?
They retain the insurance, malpractice insurance.
They
do.
And
We have
it would be-
malpractice. It
it
would
would
be
be
covered under
covered.
the general life
They
policy.
already have that, it would be covered.
Just to piggyback on something he said, because it wasn't clear to me as he was saying it, the staffing that he's talking about for this clinic is already being hired to serve other roles. This would be just another task that Mr. Bruckner feels would fit. So it's not adding additional staff. It's just tasking people that he has to have on staff for other programs and other responsibilities with this.
Absolutely. And to go back to that, it's a pilot project. We're going to do it. It's not going to cost us any money. We're going to see how it works for a year, see how it gets utilized by employees, get the employees' feedback from using it, and we can make adjustments as necessary or do away with it altogether if we so choose. But we're just recommending to pilot that and take a look at it and watch it, because we really do feel like, in talking to these other counties that are using this, it really will have a significant impact on the back end on our claims experience. Back to the flat contribution, it will be a consistent rate and it will be equity. Although it will not still be equity. But we are coming in line with the industry, we're standardizing that, and we're preparing to move forward. This is one of those things that could change as the industry changes. What we're doing here is establishing a ground level. We're seeing in a lot of counties, like Jackson County and Catawba County, they pass 100%, employee picks up 100% of their dependent coverage. So it needs to be recognized and it needs to be highlighted that employees in Macon County are still receiving a great benefit, especially those that have dependent coverage, as Macon County is paying 55% of this coverage. Recommendation number 5 is one that was discussed, and we thought about it long, we thought about it hard. We are recommending to change the third-party administrator and the network. And what happened? The changes that I've talked about up until this change were all changes that the committee put in a request for proposal. This request for proposal was then taken by our insurance broker and distributed to multiple insurance companies. We received 10 proposals back from third-party administrators. We had a very, very good array of proposals to choose from. The RFP ensured that for the most part, we were comparing apples to apples. We were going from a 90 to a dual option 80-70 plan. We were doing these things with the employee health clinic, the cessation programs, the disease management programs. So when we got all those proposals back, we felt comfortable in looking at that bottom line for the proposals. Blue Cross Blue Shield came in at $3.7 million, roughly, for the health insurance plan. And again, if you'll recall, continuing on our current plan at $4.5 million, this is about $780,000 less moving forward with our current plan. We will remain self-funded. Blue Cross Blue Shield will become our third-party administrator, taking the place of Crescent, and our network, Blue Cross Blue Shield's network, would take the place of our current network, which is Crescent. Right here on this chart are the top 5 proposals that we received. We pulled them out. As you can see, this was $130,000 less than the next lowest proposal we received. And it was almost $500,000 less than the proposal we received from our incumbent. So with that, we are making the recommendation to change third-party administrators and networks from Crescent to Blue Cross Blue Shield. Next, we looked at increasing revenue. As I said before, the committee saw right up front we were going to have to reduce our expenditures and we were going to have to increase our revenue. The proposals that I just showed you, and all 10 proposals that we received back, are based on the county funding at 80% of the maximum expected claims. Well, and the maximum expected claims level is what the insurance company says, worst case scenario, this is your maximum level of claims you're going to experience this year. The reason the county chose to put in the RFP to budget that at 80% is because for the past 13 years, according to our plan history, we've only hit 78% of that maximum expected number. So in our proposal, we put budget at 80. The committee's recommendation, however, is to budget at 82.5% of maximum expected claims and 85% if possible. And I'll tell you why. If you'll remember from the first slide, the reserve fund is, we're sucking fumes. And in order to, again, make this fund sustainable, as in the terminology Mike Norris used, and I loved it, is put wood on the porch. We got to start putting wood back on the porch. If we raise this contribution level from 80% to 82.5%, we'll put more wood on the porch. But putting that wood on the porch and, of course, budgeting at a higher level of those maximum expected claims is going to come at a cost. As you can see, budgeting at 80 here, the total plan cost, like was received from Blue Cross Blue Shield in the previous example, is $3.7 million. That's about a $445,000 increase annually to the county. At 82.5%, it's $3.8 million total plan cost, about a $530,000 increase to the county. And at 85%, it's $3.9 million total plan cost, $612,000 increase to the county annually. So those are the numbers we were looking at. And again, the committee said, we're recommending 82.5% because it is crucial that we start rebuilding that net position. And at 82.5%, if we continue with our 13-year average, we'll begin putting about 4.5% per year back into that net position and get it at a level that is capable of sustaining this fund. The second recommendation in the increase in revenue category comes as an increase in employee contributions. And if you'll recall, the county will begin contributing a flat 55%, leaving their employee responsible for that remaining 45%. And the new plan rates that we got back from the reinsurer for this plan will result in decreased contribution levels for those employees in employee child and employee children categories. So those two categories, when we shore it up and the employees begin contributing 45%, they will actually see under this new plan their costs go down. And you can see here, again, this is at 80%, 82.5%, and 85%, because how we budget that will affect the employee rates just as it does the counties. So at 82.5%, that employee child coverage, the employee's paying $75 a month. Right now they're paying $86. The employee spouse, here's a $25 increase. They're paying $200 a month right now, but at 45%, based on the new plan rates, their monthly cost would increase by $25. The employee children category would, again, this one would decrease. They're paying $200 a month right now for employee children coverage. At 45% under the new plan rates, they'll be paying $179 a month. In the family, we'll see another increase here. I figured that up earlier. I think it's about $39 a month increase for family coverage at 82.5% under these new plan rates. This will be a total increase in employee contributions of $31,215 annually. Yes, sir.
How does it come up with a 55% codependent coverage? Is that versus 50 or 75%? Or is that a standard, or how is that?
We going into it, we looked at the other plans like Jackson County and Catawba County, and we saw the trend in the industry, both in the public sector and the private sector. The trend is the employer is getting completely out of dependent coverage and passing that completely on to the employee. When we started running the numbers of passing that completely on to the employee, the rates that we came back with for monthly rates were out of this world. It was just we really did not feel like that the employees could bear that burden of 100% of dependent coverage right out of the gate, right off the bat. So then we began talking, we began negotiating among the committee members, and we looked at 50-50, 60-40, and then we felt comfortable with that 55-45 split after looking at each of those different avenues. So again, $31,215 increase to the employees at 82.5% of maximum expected claims. Lastly, recommendation number 3 for increasing revenues was to begin budgeting for retirees. In 2008 to 07-08 fiscal year, that was the last year that Macon County budgeted for retirees. And retirees, there's 52 of them on our plan right now. 52 out of the 408 total in the census. And these 52 individuals, if they're on the plan, they're treated like active employees. I mean, the plan's covering their claims, the plan's covering their costs. So we need to be budgeting an adequate amount to cover this. And at end of 07-08, moving into 08-09, contributions for retirees ceased totally. And that today, in making up that and beginning again to budget for retirees at the appropriate amounts, that accounts for $377,000 out of the $530,000 increase to the county at 82.5% of the maximum expected. This plan, it will remain high quality and it will remain affordable. To illustrate that, the first chart here is a comparison of deductibles and out-of-pocket costs under a goal plan like Macon County is proposing. And you'll see here it's compared to a peer group. This peer group is made up of Haywood County, Jackson County, Cherokee County, Catawba County, the town of Franklin, the North Carolina State Health Plan, and Lowe's, the public employer. Under the new goal plan, the individual deductible would increase from $500 to $1,000. The average deductible for that peer group is $1,053, so we're right in line with that. The deductible for the family would increase from $1,000 under the current plan to $2,000 under this proposed goal plan, if employees chose that option. The average total family contribution, that's $2,000 for the deductible. That's the deductible they have to pay for their total family. Their total out of pocket, yes, that's total. The average for the peer group is $2,600. So we're below there, and you can see here for out-of-pocket, the out-of-pocket cost under this new plan would be $3,500 for the individual. This peer group average is $3,700. And for the out-of-pocket for the family, $7,000, and the peer group average is $8,500. So in making these plan changes, it would also be important to note that the goal plan, the goal level plan, similar to that enhanced plan that Macon County will offer, is the highest level plan offered by any of these employers in the peer group. The rate comparisons, if we look at rates, and we mentioned them earlier, for the employee spouse, the $226 a month that the employee would be putting in. When you look at the comparison of the 4 other counties here with these rates, you can see here we're well below any of those counties that were included in this particular group for the comparison. The employee child at $75 is significantly below those rates of other counties. And the employee family plan, we're $20 higher than Jackson County, but other than that, we're well below the rates in the other counties when compared. We're also not a bad company on a national level. This is a graph produced by the Health and Human Services, and this tells you what the people that are coming into the marketplace, what they're seeing in terms of the health care plan that these individuals are choosing to purchase. When you look at it, 65% of Americans are enrolled in a silver plan. Bronze, you have 20%. Gold and platinum are 5%. So we're in good company. Only 9% of the people out there in the marketplace that are seeking health care coverage are going for the gold coverage, and that's because I looked at it out of curiosity. I got on the Blue Cross Blue Shield website, and this is why the chairman can get that $5,000 sign out there. No, I typed in on the website. In all seriousness, I typed in 30-year-old individual making $30,000 a year. Does not qualify, single, no dependents. The cost for a gold plan was $360 a month for that individual. And that same single individual that works for Macon County and is enrolled in the Macon County Health Benefit Plan under this current plan can get that same gold plan if they participate in cessation programs, disease management programs if necessary, can get that same plan for no dollars a month. They'll pay zero. So that just goes to show you, again, we're not in the peer group. Our rates, the out-of-pocket maximums, the deductibles, we're right in line with what is the new standard for quality health care following implementations of the Affordable Care Act. I've got one more slide I put on here. This just gives you a little bit, some summary comparisons of our current plan to the gold plan and silver plan options. The deductibles are going to increase. The out-of-pocket is going to increase. Your specialist under the gold plan would remain $50 to go to a specialist. Primary care visit would remain $25 to visit your primary care provider. Urgent care under the gold plan would be $50. It would be $70 on the silver. Health clinic, we don't currently have one under this plan. We're recommending that we institute one. They will both have health clinic availability to the gold and silver plan. Like your ambulance stay, your hospital stay, where are your ambulance ride and your subsequent hospital stay, where our current plan picks up 90% of this cost. The gold plan will pick up 80%, the silver plan will pick up 70%. And that goes back to that tier classification I showed you starting out. Generic drugs, $10 across the board. Preferred brand, $35 across the board, no change. Non-preferred brand, $50 across the board, no change. Your specialty drugs, they increase under the gold plan and the silver plan from 50 to 100. That, in a nutshell, is just a summary, and it paints a little bit of a picture on some of the changes that you can expect, or that the employee can expect under this new plan. Some additional information that I would like to share with the board and employees that they should be aware of. Again, we are changing third-party administrators, if so approved by the board. We will be doing that in the coming fiscal year. There is a change process we will have to go through. We will have to get new insurance cards. We will have to, there will be much communication between our current third-party administrator and our new third-party administrator as we're exchanging claims information on our census of the employees. There'll be a lot of information exchange going on. So if there is any difficulties experienced during this change process, it's very important that employees know that we need to give it 2 or 3 months to get working and to get moving without any glitches. But after that time, we expect that it will continue to run smoothly.
With no lapse.
We're keeping our fingers crossed. No, there will be no lapse in coverage.
No lapse.
And
Waiting for you to pre-existing.
We just encourage employees to be patient, and if they do experience problems, contact our Human Resources Department. We're going to send out Mike's personal home phone and address, so they can come see him or call him. And also, under the current health insurance plan, the deductible runs on a calendar year basis, where you meet your deductible from January 1 to December 31st. Changing the plan, we're going to change the deductible to begin running on a fiscal year basis, just like the renewal of our plan does. But right now, we've got our deductible run from January 1st to December 31st, and our plan year is going from July 1 to June 30. So we're going to marry those two. We were going to do that either way. We were going to do that if we chose to stay with our current plan provider, or we were going to do that if we changed. It creates an accounting nightmare for finance to keep track of those two things. When we do this, it's important for employees to know that any amount that an individual employee has paid toward his $500 deductible in the calendar year, it will apply toward the new $1,000 deductible when we go under Blue Cross Blue Shield and begin on the fiscal year. So basically, any amount they've paid will be honored toward their deductible. This will not be the case on the silver plan. Those participating in the basic silver plan will not receive credit for previously paid amounts on the deductible. So that is some additional information to be aware of if indeed the board chooses to move forward and authorize us to move forward with this. And that's why that we're here tonight. The Health Insurance Committee, we feel like, as we beat this horse to death. And what we presented you with, we went out and we got 10 proposals that reduced the health care benefit for the employees and their families. It increased deductibles, increased out-of-pocket costs, and increased contribution levels from the employee. I realize that $529,000, that is a lot of money, and I've tried to keep the board kind of aware as we move through the fiscal year, and in my budget message last year, that this day would be coming, and it is here today. And what we would be requesting is for the board to authorize me to move forward with the implementations of these recommendations as presented in fiscal year 15-16. And I hope if you have any questions, please ask them. I know this was there's a lot of details that were left out. This was kind of 30,000 feet, but I hope you saw kind of the picture of what had happened, what created the needs for change, but most importantly, those employees that were willing to sit down and have the conversation and make sacrifices to address this need and make it to where that employees following them will have a sustainable and affordable health care plan for years. 408, and Mr. Shields, that changes. That's as people are leaving, retirees coming in, people, retirees going out, new employees coming in. That census is an ever-changing number. But the RFP that went out was quoted or adjusted to quote at 480 employees. That's what these numbers are based on. 52 of those are retirees.
Oh, 52 of that 408?
Are retirees. Another thing we're looking at, and again, we didn't get into every detail of the retirees that are over 65 and are Medicare eligible. Moving them to Medicare would be their primary plan, and the county would provide supplement. And based on the figures that Lori and Mike have discussed, and we're seeing what kind of decrease are we seeing?
I've got to run some new numbers, but on rough numbers, it's probably just $30,000.
Roughly $30,000 is all the difference that would make. But we are going
In
to.
the future, that could be big enough.
Yes, absolutely.
Big.
Absolutely.
Big.
And companies are going with that. As Mike can tell you, there's little reason to pay full premium on a group type plan when you've got Medicare sitting there as a primary insurer that they paid into the system to get.
One recommendation that I left out, it's included in your report, is the continual meeting of this health insurance committee. This has been a very valuable committee. I can't say enough about what they have learned and how familiar they became with the health insurance, the changes that we've had to make in our health insurance fund, and how we went about doing that. Had great assistance throughout the process by Hawaii Insurance. And this is just, these right here, it is the lowest number that we can bring back to the board to do what we need to do and turn the health insurance fund into a complete 180 and get headed in the right direction. Now, the health insurance industry, and it was just like me and Chester were discussing on the phone the other afternoon, it's changed and it's going to continue changing. And we feel like that through these changes, we put ourselves in a position, through the changes we've made to the plan now, to better adjust to those as they come. But they will come, and we will need to make adjustments. It could be that we start experiencing, if this employee health clinic works out, there's major conditions get identified through the disease management program and get addressed. It could be that we start experiencing 76% of our maximum expected claims. So what can we do then? We can reduce the county contribution back to 80, which would in turn reduce the amount the county has to put in and reduce the amount the employees pay for their rates. So there will be changes, there will be a need for change, and I think it's important that this committee stay together and keep the board apprised of these changes as they become necessary.
Very good there. Pass this so we can see what's in it.
I did have one thing I wanted to say. I'm kind of a bottom line guy, so there's a number that Derek left out of his presentation that's very pertinent to the bottom line. When he showed you the county contribution ranging from, depending on if we could do it, yeah, we've got a county contribution ranging anywhere from 445 to 612, and then maybe the slide before or after that, we talked, and here we stick that one back up. You see the employee increase between 16.5 and 45. Now, one thing which I didn't realize, I hadn't put together, which is important, of that 560 to 612 or whatever it is, 377 is money we're already paying, we're just pretending. It's coming out of fund balance.
Comes out of the position.
But the other number that's really important is and Derek talked about going from the 90% to the 80%, and that 10% change is a $400,000 addition to the county in the higher co-pays, in what we're going to pay to go to the doctor. So when you look at, I didn't want you to have the assumption that we're asking the employees for $45,000 and the county for $600. We're actually asking the county for a couple hundred. I'm not going to do the math in my head, but those two numbers you saw minus the 377. But the employees, you need to add that $400,000. That's what they're going to see, not involving the county. It's what's going to go to their doctors, what's going to go to their pharmacists, et cetera, et cetera.
They will be paid. The employees will make up that that $400,000, that was the reduction from platinum to gold.
That was the first thing I learned from mine, is every 10% change in our plan is about a $400,000 hit to the employee. Unless we were to go the other way. Then
A couple of points that you have to go back and remember. The difference in this and is if you stay on the course we're on.
Right.
If you stay back up to that slide that shows the 1.32 right there, there's your cost if you don't do this.
Yeah.
Everybody get that? I mean, that's huge. The other thing, go back to the slide where it shows the silver, gold, little circles. Let me just make a comment, and Mike can attest to this, being in business as well. We've spent the past several years working in this market. I would say that's a national. I would say in this area, I can say from our experience, we probably have 70+% of people in silver. Would you agree with that? I don't think it's as low as 70 to 75% of people. I think in my agency, we're probably closer to 80, because those are people who either are paying it themselves or are paying it with the assistance of some tax credit, which you could equate somewhat to the county being a partner and get paid this premium. But most people in today's world, a platinum plan, nobody buys platinum plans. Is that fair, Mike?
Very special circumstances.
So that's I think that's important to note that you guys certainly, as the board needs to understand, they're not shortchanging the county employees as compared to the folks outside, and that's just reality. Nobody has a platinum plan. I've got a bronze plan, and I'm in business. I've got a bronze plan. Like I can't afford a platinum plan. I don't want it. You know, I'm willing to gamble with some higher deductibles. And also the deductible increase from was it 500 to 2,500 on the silver?
500 to 2,500, yes. For the individual, 1,000 to 5,000.
And Mike, unless I'm mistaken, that deductible is hospital deductible. It is not a deductible that has to be met before you have doctor co-pays,
Correct.
drug co-pays, urgent care. So it's not a deductible increase unless you have a hospitalization. It seems like a
Or
huge
medical,
difference.
or durable medical equipment. It is an increase.
But when people have durable medical equipment, they generally have to hospital stay.
And to also, Mr. Chair, I'd like to add that the preventative care, where it's going to be free under this plan, you'll pay zero at a primary doctor or a specialist doctor if you're getting preventative care, mammograms, prostate checks,
Defined as by your doctor, and
Right.
what they
So-
think you need.
And then the health clinic, right now, when you go to your urgent care, which is most people go to urgent care, the emergency room, when they have something wrong with them. If you've got a cold, come in your primary doctor, if he's backed up, we'll go to urgent care. That's $50 right now. The same cold, you can go to that employee health clinic for $5, get a prescription for $1, and be out the door. And have an hour of sick leave. The employee will have an hour of sick leave that they've been given. If they go to the clinic, it won't count towards their sick leave accruals.
Plus, it'll make them healthier and will take it back to work and get everybody else.
Right. And the health clinic is also available to dependents and retirees.
And anything the clinic does, they're going to share that information with your primary provider. So your primary care provider, if you go to the health clinic and they treat you, they're going to forward that information so that they know it's in your medical record that you were treated at the health
Medical
clinic.
clinic's going to be staffed by a real doctor.
It would be a PA. And
NFP.
that they're hiring anyway. I mean, we're just going to benefit from the use of it.
And we looked at things like, we met with, we had a presentation like on the teledoc that used at Angel right now. It just doesn't make financial sense because we already have the infrastructure of a health clinic in place. And all we have to do is put money toward the operations, which that money is coming from the federal level that the county won't have to experience any increase in cost to provide it.
There's a measure on it.
Go ahead. No, go ahead. No, I just make you all, you feel vested in this now, don't you? But
Paul says he appreciates it, we'll vote no, be careful.
well, what irritates me about it is that the county stopped, decreased their contributions, and somebody was asleep at the wheel. Whether it was this board or whomever, I don't know. I don't want to see it happen. That happens all the time in government. We don't take care of what we got living where we're buying you. Well, here we are, we're having to cough up $600,000 to make up, in my mind, bad management or a bad choice at some point. We can't let that happen. We have to plan these things, and that's what irritates me about the whole thing. No, I'm glad you employees are willing to make concessions. You know.
Well, we
Paul,
need,
I'm sorry.
go ahead.
To piggyback on that comment and what Derek said, our goal or our want is to keep this committee together and back this plan up with policies that will not allow this to happen.
Excellent.
For instance, if we are able to fund at 85% to get that fund level back up, maybe we're not going back to $6 million, but we get enough where a bad claim year is not going to break us. Maybe then we drop it to 80. But we want to spell that out with policies to support this plan so that future boards, future committees, future employees are not led down this path.
Excellent.
The only concern I have, Derek, is just one, is we all got insurance, we all pay a lot of money for insurance, everybody I know, and I only pay a good one, a lot for the insurance. So the concern I have, you get all the money and you got somebody sick, and you have a problem with the insurance company, who do you go to? With Blue Cross and Blue Shield, they carry the big stick, they are the big boys. And so you go to Mike Norris, with Cresta, I could call Marina Howard, if I had a boy call me, and they would give response. The Blue Cross and Blue Shield, I dare you to be able to call somebody that's in charge of Blue Cross, even on the regional level. We tried. So who does the employee call? Who do they talk to? Do they have a problem, and they will have a problem.
Right.
Well,
That would be me.
that's not fair to Pam. I mean, she can't.
I do it now,
They call
Ronnie.
her now.
They call me now.
Call her now.
They call her now.
That shouldn't be any different. The claimant will
They
pay
call
for
me,
that.
I